Okay, so welcome to this video. In this video what we're going to talk about is anxiety, and also we're going to talk about anxiolytic drugs. Okay, so the structure then for this video, we're going to start off by talking about different types of anxiety, and we're going to talk about 6 different types of anxiety disorder. Okay, then what we're going to do is we're going to move on to talking about the fear response, because anxiety is all about the fear response. Fear is a perfectly healthy physiological thing when it occurs in response to something that is genuinely dangerous. Okay, we have a fear response because if something genuinely dangerous presents itself, we want to be able to either fight or flight, and the fear response is all about initiating that fight or flight response, basically, to save you from this dangerous situation. Okay, the problem in anxiety is that either you have this fear response on at a low level all the time, or you have intense bursts of it in response to things that shouldn't really initiate a fear response. Okay, so potentially harmless things, or even they can occur spontaneously in some types of anxiety. Okay, and we'll see all of this as we go along. Then what we'll move our attention on to is the anxiolytic drugs. Okay, so just to clarify, anxiolytic drugs are drugs that are used to treat anxiety. The logic in the name is anxio, this portion here. This means pertaining to anxiety, okay? And then lytics. Lytic comes from lysis. Lysis means to break, basically, to break up into pieces. Okay, so it kind of means to break anxiety, okay, in the dramatic sort of sense. Right, okay, so we're going to start off by discussing the 6 different anxiety disorders that I'm going to talk about, okay, and then we'll move on to the fear response. Right, so firstly, I need to tell you about the fact that there is a Bible in neuropsychiatric medicine, okay, and this book tells us, well, it classifies all mental disorders up. Okay, so it is what tells us what it counts as an anxiety disorder and what does not count as an anxiety disorder. Okay, so this book is known as the DSM, okay, and there are several editions of the DSM. The most up-to-date DSM is the DSM-5, okay. Now, what does DSM stand for? Well, it stands for the Diagnostic and Statistical Manual of Mental Disorders. So the D is for diagnostic, okay, the S is then for statistical, whoops, missed out the T, okay, you have to correct that, and statistical, and then the M is for manual, so it's the Diagnostic and Statistical Manual, and I always found it odd initially that the abbreviation for this doesn't actually involve the crucial bit, which is of mental disorders, okay, because the Diagnostic and Statistical Manual could be for over anything, really. Okay, so they miss out the crucial bit of information in the abbreviation. I don't really know what the logic is for that, just because they wanted the abbreviation DSM, I suppose. Right, so Diagnostic and Statistical Manual of Mental Disorders, and we are on the Diagnostic and Statistical Manual of Mental Disorders number 5. Okay, DSM-5. Right, so now what I'm going to talk about is the 6 different anxiety disorders that we are going to talk about, okay, and these are all classified as anxiety disorders by the Diagnostic and Statistical Manual of Mental Disorders 5. Okay, right, there are other anxiety disorders as well beyond these 6, but these are the main 6. Okay, so, number 1 then. Number 1 is panic disorders. Oh, and by the way, at the moment I'm just going to write out their names. In a moment I'm going to come back and talk through each one and give accessory details. Okay, so, whoops, get rid of the S, it's just called panic disorder. Okay, so panic disorder, just to give you a sort of one-line taster, is basically where you have spontaneous panic attacks which aren't cued by anything. Okay, they're generated by the brain. Right, but we'll come back to that in a moment. Number 2 The second type of anxiety disorder is what's known as post-traumatic stress disorder. Okay, and post-traumatic stress disorder is more commonly known by its abbreviation, which is PTSD. Okay, P for post, T for traumatic, and then S for stress and D for disorder. Okay, so PTSD, that's the second one, and I'll underline PTSD in turquoise here. Okay, right. The third anxiety disorder that we are going to talk about is what's known as Generalized anxiety disorder. Okay, and this involves a chronic, low-grade fear response that is active all the time. Okay, so generalized anxiety disorders. People with this are just continuously on edge, basically. They're continuously worried. So generalized anxiety disorder, which is sometimes abbreviated down to its initials, GAD for short, G for generalized, A for anxiety, and D for disorder. We'll underline this one in red. Alright, okay, fourth type of anxiety disorder, okay, is what's known as social anxiety disorder. Okay, now social anxiety disorder is often more commonly just called social phobia. Okay, which makes sense because of course a phobia just means a fear of something, and indeed it is a fear of social situations. However, it's considered a separate condition from other phobias. Okay, because it's generally a little bit more difficult to treat than normal phobias. Normal phobias, which are called simple phobias, we can treat those extremely effectively. We can cure them with cognitive behavioural therapy, and I'll talk about what this cognitive behavioural therapy involves later. Whereas social phobias tend to be much more difficult to treat with cognitive behavioural therapy, and they tend to require treatment with both drugs and cognitive behavioural therapy to try and get some alleviation of the symptoms. Okay, it's generally also something that affects young people worse than it affects older people as well. Okay, right. Potentially reflecting the aspect of the fact that younger people have less experience in social situations, or maybe reflecting some developmental stage of the brain. Okay, so number 5. Number 5 is the simple phobias. Okay, so these are the irrational fear of a certain stimulus. Okay, so for instance, a dog phobia, fearing dogs. Okay, initiating a horrendous fear response every time you see a dog. Okay, which is not obviously, well, potentially a dog is dangerous. Okay, but generally, dogs that are owned by responsible dog owners are not dangerous. Okay, other common examples are spiders and snakes, and heights is another very common example of a simple phobia. Okay, so we'll underline simple phobias in pink here. Right, and then the final anxiety disorder that we're going to discuss is one that is a little bit more controversial as to whether this should be considered an anxiety disorder. It is Obsessive-Compulsive Disorder, okay? Again, which is usually abbreviated down to its initials, OCD. Okay, now, personally, I think Obsessive-Compulsive Disorder is an anxiety disorder. I agree with the DSM's categorization as an anxiety disorder, but I will present you some arguments later on when we discuss obsessive-compulsive disorder for why it should maybe be considered closer to something like Tourette disorder. Okay, right, so I'll underline obsessive-compulsive disorder in blue here. Right, so let's now go through each one of these different anxiety disorders in turn and discuss it in more detail. So we'll start off with panic disorder. Okay, so what happens then in panic disorder? Well, I gave you a little hint of this earlier on. So basically in panic disorder, this is a very disabling condition. Okay, in panic disorder you get very intense fear responses spontaneously. Okay, so you can be walking down the street perfectly happy, and then you'll get one of these horrendous panic attacks, and it is cued apparently by nothing. It's just spontaneous. Okay, so something inside the brain has decided, I'm going to initiate this now, and then you've had this horrendous fear response initiated over nothing, basically. Okay, and these are obviously very, very disabling. So let's talk about what a panic attack actually involves. So I've had panic attacks before in my life. They weren't over nothing, they were cued by things, and they really are horrible. You just want to run, that's all you can think about doing. You just want to run. Okay, so what happens in a panic attack? You get a very, very intense conscious fear. So the fear experience is very, very intense, and you feel as though you're losing control. Okay, that's what I would describe feeling when I've had panic attacks before. Okay, you really do feel as though you're losing control, that you can't cope anymore. Okay, and apparently some people even feel as though they're dying. I have never felt like I'm dying in them. But you have to remember that what is a panic attack for? A panic attack is supposed to be initiated when a predator is about to eat you, okay? It's there to be initiated when there is an intensely dangerous stimulus present, okay? So the feeling that you are about to die is not unwarranted, basically, for what this is all about. Okay, right. Then what also happens is you activate the sympathetic nervous system, and we'll go through all of this when we talk about the fear response in more detail later. So the sympathetic nervous system is a special collection of neurons, okay, often abbreviated down to the SNS for short, okay, which stands for the sympathetic nervous system, okay, and basically in a fear response, such as in a panic attack, you're going to activate this nervous system, so all of these sympathetic neurons are going to start discharging, and they cause all sorts of physiological changes, and one of the very notable changes that they cause is their effect on the heart. Okay, so I think I'll underline sympathetic nervous system in turquoise here. Okay, so a lot of these neurons of the sympathetic nervous system act on the heart, and they do two things to the heart. They firstly make the heart beat faster, okay? So it's going to start beating faster, and that causes what's known as tachycardia. So tachycardia means that the heart is beating too fast, faster than it would normally anyway. Okay, and also they make the heart beat more powerfully. Okay, so every time it beats harder, all the little muscle cells of the heart, and I think I'll draw a little heart here. Okay, so here is the right atrium. Here is the, so I've got something to point at, is the motivation for why I'm drawing this. Okay, here is the left atrium, and I'm running out of space here, it's going to have to sort of go there. And here's the aorta coming off here. So right atrium, right ventricle, left atrium, left ventricle. Okay, here's the pulmonary trunk here. Okay, right, so all the little muscle cells of the heart are going to start beating more powerfully, and they're going to be shoving more blood out. Now, what is the motivation for making the heart beat faster and the heart beat stronger? Well, it means that the amount of blood you're going to get pumped around the body in a minute, okay, which has a special name. The amount of blood that gets pumped around the body in a minute is known as the cardiac output. Okay, the cardiac output is going to go up basically when the sympathetic nervous system activates the heart. Okay, now why is that advantageous? Well, if you're in this life and death situation, you're going to want to run. Okay, or you're going to want to fight if you're brave. Okay, if you think you can take whatever this threat is, you're going to want to fight. Okay, both of those things are going to require you to use your skeletal muscle. Your skeletal muscle is not usually being used that much, okay, but suddenly it's going to have a lot of use, okay, and to be used it's going to need a supply of oxygen so that it can make energy in the form of ATP. Okay, remember respiration requires oxygen. Okay, so to supply the increased oxygen and also increased nutrients to the skeletal muscle, you need more blood to be pumped around the body so that this blood is going to the skeletal muscle cells. Okay, and I should also point out that the skeletal muscle cells usually have a very low blood supply, so the blood vessels of the skeletal muscle cells, skeletal muscle tissue are usually kept at a very narrow diameter, so that very little blood is actually flowing through the skeletal muscle tissue. But then, when the sympathetic nervous system becomes active, you're going to open up the blood vessels in the skeletal muscle so that you get more blood going to the skeletal muscle, okay, so that you're ready to run or fight. Okay, right. Now, the realization of these two things for the patient having the panic attack is that they're going to get palpitations. Okay, and palpitations just means that you become consciously aware of your heartbeat. Okay, so if you go jogging, then you will be able to feel your heartbeat. That's palpitations, when you can palpate your heart effectively. Okay, so in a panic attack, you get this intense fearful experience, and you also get palpitations. You can start to feel your heartbeat. The other thing you get, which is again activated by the sympathetic nervous system, is you're going to start sweating. Okay, so the sympathetic nervous system activates the sweat glands. So that's another symptom of panic attacks. Okay. In addition, you start trembling. Okay. So that's a common symptom of panic attacks, that you start trembling, and that's what really makes it noticeable that you're having a panic attack to other people. And the other thing is that you become very, very dizzy. You can't really concentrate at all. Your mental function isn't very good, okay, when you're having a panic attack. You can't really, if you were given a maths problem, you wouldn't really be able to do it that well if you were having a panic attack, because your conscious ability to think is quite low. All you can think about doing really is running. Okay, so that's my description of what a panic attack is like to have. And in panic disorder, you don't initiate these things to horrible stimuli. Instead, they're just initiated spontaneously. Okay, so this is a very, very disabling condition, therefore. Okay, so these people who have this condition, generally, they're afraid of going out in crowded places in case they have a panic attack. They don't want to have a panic attack in front of people. Okay, so generally they end up avoiding crowds. They end up avoiding places where they would be trapped if they were having a panic attack. So for instance, they avoid elevators because elevators are confined space, and they wouldn't want to have a panic attack in that confined space where you are trapped. Okay, and some people who have this condition, it can be so debilitating that they end up not leaving their house because of fear of having a panic attack in front of other people. Okay, they want to stay in the safety of their house where they know that if they do have a panic attack, they can deal with it in privacy, basically. Okay, so some people end up retracting completely from society, basically. And that sort of avoidance of everything, there's a special word for avoidance of everything. That's known as agoraphobia. Okay, so when you sort of stay in your house and avoid everything, pretty much, that's what's known as agoraphobia. Okay, so some people with panic disorder can end up developing agoraphobia. Okay, and we give people with panic disorder who have developed agoraphobia cognitive behavioral therapy, CBT. Okay, you can't get rid of the panic disorder itself with cognitive behavioral therapy, and I'll just write out that that's what CBT stands for. It stands for cognitive, that's the C. B is for behavioral. Okay, and T is for therapy. Okay, so therapy basically just means counselling people, talking to people about how they're going to cope with going outside, going and dealing with situations that they've retracted from. Okay, clearly cognitive behavioral therapy cannot stop them having these spontaneous panic attacks. For that, we need medication, and generally these people are treated with either SSRIs or benzodiazepines, so we'll come to those later on. Okay, and those to an extent will help stop them having these spontaneous panic attacks, at least reducing the frequency of those spontaneous panic attacks. Okay, but the cognitive behavioural therapy is to try and get around the agoraphobia that has been triggered by years and years of having these panic attacks occurring spontaneously. Okay, so to try and get around their fear of crowded places, their fear of elevators, that has stemmed from their fear of having these panic attacks in trapped places, basically. Okay, right. Now let's turn on to the next anxiety disorder. So let's turn our attention now to post-traumatic stress disorder. Okay, so what are the symptoms then of post-traumatic stress disorder, and how does it occur? Well, most people are familiar, at least to some extent, with what post-traumatic stress disorder is. Okay, it begins basically with an extremely traumatic experience. That's why it's called post-traumatic stress disorder. Okay, so you have either an extremely emotionally traumatic experience, or you have an extremely physically traumatic experience. Okay, often that you have both, basically. Generally, post-traumatic stress disorder occurs in people who have gone to wars, basically, and they've survived the war, but they return back, firstly having seen awful things, and secondly having sustained terrible injuries, basically. So generally you have both emotional trauma and physical trauma coupled together. Okay, right. And post-traumatic stress disorder, or PTSD, was first described in World War I survivors. Okay, so soldiers from World War I. Okay, and the characteristic symptoms of post-traumatic stress disorder are that you have what is known as emotional numbness. So I'll try and explain what is meant by emotional numbness. So basically, usually in our lives, our happiness meter is, if we can imagine such a scale. So if I draw a little graph here, okay, and this is in a light-hearted spirit, this graph. Okay, so if we have time here, and then we have happiness on the y-axis here, our happiness meter will sort of go up, it'll go down, so we'll have something good happen to us, then we'll have something bad happen to us, then it might go back up again, it might bob down, you know, it's all over the place. It's a roller coaster ride, basically. Sometimes we're feeling very good, sometimes we're feeling down, sometimes we feel very, very good, etc. Okay, in emotional numbness, you just sort of have a line that looks like this. You stay sort of in the middle. You're not sad, you're not happy, you just don't really feel that much at all, basically. So if something good happens to you, you feel nothing, basically. If something bad happens to you, the good thing is that if something bad happens to you, you feel nothing. You have flat emotions, basically. Your emotions are hugely lowered. Okay, so that is what is meant by emotional numbness. Life is no longer a roller coaster ride, instead it just sort of remains flat like that. Okay, so that's a light-hearted explanation of what is meant by emotional numbness. Okay, right. So that's one of the things that happens in post-traumatic stress disorder. The other thing is that you continuously relive the horrific traumatic experience, and you have very, very vivid memories of the traumatic experience. So you relive the experience very vividly, okay? And you will have these visions of your experience continuously, basically, in response to different cues. So loads of different cues will initiate vivid recollections of the traumatic experience. So, for instance, the example that's often given is people returning from the Vietnam War. Okay, in the Vietnam War, helicopters were used hugely, and people returning from the Vietnam War, often their post-traumatic stress disorder will be initiated. They'll have the recollections of the horrific experience in response to hearing a helicopter flying overhead. Okay, so that's, for example, a cue that will cause you to relive the terrible experience. Okay, right. The other thing that's key in post-traumatic stress disorder is that you have what's known as hyper-arousal. Okay, so basically the brain is always on edge. Okay, it's always waiting to initiate a new fear response, basically. Okay, and this is sort of manifested in the fact that you have a very exaggerated startle response. So let me now explain to you what a startle response is. So basically, if you're sitting quietly by yourself and someone sneaks up on you and then shouts boo at you, you will jump. Okay, that is what is meant by a startle response. Okay, startle response is the fancy way of saying that you jump when you are surprised. Okay, so when a stimulus is suddenly presented, you initiate a startle response. Okay, in people with post-traumatic stress disorder, the amount by which they will jump will be much larger than a normal person, basically. So that is what is meant by exaggerated startle response. Okay, in addition, they also suffer with bad sleep. Okay, so disordered sleep. So they have problems with sleeping. Okay, again, this is because, it's thought to be because the arousal state is too high. They don't want to sleep because they're continuously afraid that something terrible is going to happen, basically. The idea in post-traumatic stress disorder is that once you've experienced these incredibly traumatic experiences for an incredibly long time, that permanently changes the brain so that it's expecting horrible things to happen and it's continuously waiting for them to happen. And that's why you have this hyper-aroused state, okay, so that you're ready for when something terrible happens, basically. Okay, right. Now, again, post-traumatic stress disorder, it's usually I keep saying this word but it doesn't actually exist, treated. Post-traumatic stress disorder is generally treated with the antidepressants, mainly by SSRIs, which we'll come to. Occasionally, if the SSRIs aren't really working, then you might use benzodiazepines. And that's the case with most anxiety disorders, that firstly you try the antidepressants, and there are many different antidepressants that you have available. Okay, we're going to talk about SSRIs, SNRIs, and the tricyclics. If none of those work, then you can move on to benzodiazepines, okay, which are slightly more powerful but also more dangerous. Okay, right. So next up we'll talk about the generalized anxiety disorder. Okay, so this one, the name tells you completely what it is. This is basically you are just continuously on edge, basically, in generalized anxiety disorder. You've always got a low-grade fear response being initiated. Okay, so you're in a constant state of initiating a fear response, although it's very minor. You're not initiating a full-blown panic attack. You're just initiating little fear responses all the time, so you're just continuously worried, basically, in generalized anxiety disorder. Okay, right. And what is found in people with generalized anxiety disorder is that they do continuously have high heartbeats, okay? So they continuously have tachycardia, okay? And tachycardia long-term is not good, okay? And also, their sympathetic nervous system has elevated activity continuously. So they have high SNS activity all the time. This drives the tachycardia that's continuously present, and also many other downstream things as well. Okay, so that's all I've got to say about generalized anxiety disorder. Now let's move on to social anxiety disorder, okay, or social phobia. Okay, so in social anxiety disorder, you don't have generalized anxiety disorder. You're not worried all the time, but you are worried as long as you're in social situations. You're fine when you're sitting on your own in a darkened room, but when you're in social situations, then you start getting worried. Okay, so particularly it's generally worse for when you have to perform in front of people. Okay, so there's particularly performance anxiety, stage fright, basically. So we can all relate to that, at least to some degree. But in social anxiety disorder, it really is, you get very, very scared when at the prospect of having to perform in front of people. Okay, so everyone generally gets nervous before having to make, a public speech or something. But in people with social anxiety disorder, that's at a different level to what would be normal, basically. Okay, so that's performance anxiety, and really what drives it, or what at least is thought to drive it, and whenever you ask someone with social anxiety what are they fearing, generally what they'll say is that they fear the humiliation. Okay, so it's viewed as a phobia of humiliation, basically. Okay, but it's probably a little bit more complicated than simple phobias. Okay, so rather than just being a simple phobia to the fear of humiliation, it's probably a little bit more complicated than that. Okay, because it's not as easy to treat as a simple phobia. Simple phobias, which we're about to discuss, they can be cured with cognitive behavioral therapy. They are the one anxiety disorder that we can truly cure, and we don't even need to use drugs. Well, you can use drugs occasionally, but you can do it with cognitive behavioral therapy. Okay, social anxiety disorder is generally more difficult to treat. Okay, right, so let's now move on to simple phobias. Okay, so, simple phobias then. Simple phobias, there is nothing really wrong with the fear machinery, except for the fact that you initiate a very, very powerful fear response that sometimes can get up all the way to a panic attack in response to a stimulus that is not threatening. Okay, so you initiate the response to a bear being behind you to stimuli that are just not worth that response, basically. Okay, so for instance to spiders and snakes and heights. Okay, those are the very, very common ones. Okay, but the machinery is not fundamentally damaged, basically. Unlike in panic disorder, where you're getting these panic attacks being initiated just spontaneously. In the case of simple phobias, you're not getting them initiated spontaneously. They're being initiated in response to a stimulus. The problem is that the stimulus is just totally unworthy of that panic attack. Okay, right. So generally what has happened in the case of a simple phobia is that long ago you've had some terrible experience with that stimulus. Okay, and ever since you've been frightened of that stimulus. So for instance, going back to the example of a dog phobia, let's say when you were a very young child you got bitten by a dog. Okay, that might lead you to develop a dog phobia, especially if you've then never had to confront a dog since. You might then avoid the dog, and if your parents then allow you to avoid the dog, then dogs forevermore, then it can develop into a dog phobia. If you avoid dogs for the rest of your life, then you will gradually develop this dog phobia. Okay, so that's how simple phobias are generally thought to arise. You have some horrible experience which leads you to then avoid the stimulus. Okay, and that avoidal of the stimulus nicely negatively reinforces the phobia in the first place. Okay, right, but simple phobias can be treated in a very easy way, and we can cure them, okay, with cognitive behavioral therapy, CBT. Okay, and what this involves basically is just making the person confront their phobic object. Okay, so literally what happens is if you've got a patient with a dog phobia, you say that you're going to bring in a dog now. Okay, you sit down with them and you say you're about to bring in this dog, and then of course they're not going to want you to bring in the dog, but you're going to talk them through coping strategies for how they're going to cope with being presented with the dog. Okay, and if they really cannot cope with you bringing in the dog, if they're literally barricading the door to stop you bringing the dog in, then you can give them drugs to calm them down. So you can use benzodiazepines usually to calm them down. Okay, and then you can bring in the dog. And the idea is that by making them confront their fear, their brain will then remold as it realizes that this dog is lovely and isn't dangerous. Okay, so the brain is perfectly healthy. All you need to do is put in the correct stimuli to make the brain remold itself, basically. So if you show the brain that the dog is not dangerous at all, the brain will remold itself so that it no longer is initiating the panic response to the dog anymore. Okay, and you can cure simple phobias just with cognitive behavioural therapy. So as I say, the only cases where you need to use drugs is if you literally cannot bring in the phobic object or the phobic stimulus because the person is barricading the door because they won't let you bring them in. Okay, in that case you can use benzodiazepines to calm them down. And you'd use benzodiazepines rather than antidepressants, because antidepressants take weeks and weeks to work, whereas benzodiazepines work within 30 minutes, so they're acute treatment for anxiety. Okay, right, so we will call it there for this video, and in the next video what we'll move on to is discussing the final sixth form of anxiety disorder that I said we were going to discuss, which is obsessive-compulsive disorder.